All right, hello everyone. Thank you for watching. My name is William MacGregor. I'm a PhD candidate in the School of Health Policy and Management at York University, with a particular focus on health and disability policy, in particular equity. So I'll be speaking today about some of my own research. Yeah, thank you for joining me. So I'll be mostly going off a PowerPoint. All right. Yeah, so the title of my talk today is Poverty Policy in the Ideal Disabled Neoliberal Subject. This is based off of my own research. So this is myself. I identify as both a mad and disabled theater artist, and then also a PhD candidate on the School of Health Policy and Equity, or sorry, that's our name of our program. My particular focus is disability policy and poverty. My work is informed by my own experience with disability, chronic illness, and chronic pain. And my research primarily critically examines federal and provincial disability-related policies and programs, particularly around income and their impact or lack of impact on poverty and marginalization among persons with disabilities in Canada. And additionally, I'm interested in broader issues of health policy, politics of health, and the broader equity concerns around federal and provincial policies in the area of disability, health, and healthcare, as well as developing arts-based research projects that examine and stage the experiences of persons with disabilities. So we'll get right into it. So overall, I did thought it would be useful just to, kind of put a marker down and define the concepts of which we'll be talking about today. So I pulled this from scholar Michael J. Prince's 2009 book. Prince is an excellent, fantastic scholar out of the University of Victoria who produces excellent work, particularly around political economy and critical policy studies in the field of disability. But the definition he'd offered in his book is, quote, disability is defined, sorry, quote, as an assemblage of socioeconomic, cultural, and political disadvantages resulting from an individual's exclusion by society. So disability exists or occurs when a person with impairment encounters barriers to performing everyday activities of living, barriers to participating in the social mainstream, and or barriers to exercising his or her human rights and fundamental freedoms. Here, disability is understood as a social process more than in some individual condition, end quote. So in my own teaching, my own discussion about this, disability, impairment is kind of, what an individual may have, but disability and particularly disablement is what a society kind of imposes on those individuals by not being more accessible, by not, having a universal standard of accessibility. To which I will add both from the work of scholar Marcia Rioux of York and scholar Marta Russell, who have a more specifically political economy of disability outlook, that our modern concept of disability is actually tied to the Industrial Revolution, where a normative body was one that was capable of factory labor. And thus, any body that deviated from this norm was one to exclude, one to police, and eventually even exterminate. And the link, and this is particularly important for my talk today, the link of disability and our societal definition of disability to labor market participation is crucial. So, what is disability policy? So, disability policies are social policies across a range of areas within and across levels / orders of government. So this can be in healthcare, it can be social assistance, it can be in the field of education, childcare, taxation as a disability tax credit, immigration, building codes, accessibility requirements. Really, because disability is something that is kind of impact and such a diverse your lived day-to-day experience. The policy arenas that deal with that are spread across many, many different disciplines. It can be everything from, is your bus, accessible? Do you have ASL services when you go to the hospital, right? Or, do the Netflix and, Amazon Prime or Prime Video have, do they mandatory to include closed captioning? Really, it's such a wide field, which is actually one of the difficulties, that it's not kind of one narrow area. There's not a single minister at provincial or federal level that's really kind of responsible for this. But overall, so disability policies span a whole bunch of areas within government, and then across levels of government. And this is actually one of the big political difficulties of getting kind of serious action here. So overall, there are essentially three goals of disability policy that we've, I kind of covered in my own review of the scholarship. So equity, access, and then support. So the first, equity, is to ensure that persons with disability are not discriminated against. Access, the second one, is to ensure that they're able to participate in all aspects of Canadian society. Yeah, so this is the kind of one we think about, particularly in Ontario, with the Accessibility for Ontario's Disability Act. Thinking about built spaces, you're thinking about potentially mandated work from home options. Access is very, very broad because also human beings' needs are very broad. Every body and every body mind is different. And then finally, support. And so this is persons with disabilities are able to hire goods, or there should be goods and services to meet their needs. But particularly one of the points I want to emphasize is disability policy is how the state, how governments, how nations construct identities of disablement. And then, this is crucial, specifically organizes and constructs the relation of both ability and disability. There's a lot of discussion, and I'm sure for many of us, I won't offer a definition of the socio-political model, also known as the social model. But one of the things I've found is, there's a lot of discussion of this in the scholarship. You'll see it reflected in Supreme Court decisions that I've read. But I have found in my own work and my own analysis that despite rhetoric and a lot of talk around the socio-political model, in actual fact, much of policy is still anchored in retrograde frameworks, such as the medical model and the charitable model. And into this, I'll introduce one of the key foundational parts of my own research and my own analysis, is the neoliberal hijacking of the word reform. So neoliberalism, to just give kind of a back of the envelope definition, is literally new neoliberalism, new liberalism, also known as, I think, new classical liberalism. Essentially, this is coming out of social liberalism, which is what built the welfare state. So after World War II, you think of Franklin Delano Roosevelt in the United States, you think of Pearson. We built a welfare state. We built social programs. We had high tax rates, and the country was, well, yeah, in some ways, not for everyone, a lot more progressive and fair. But neoliberalism started in the 1980s and essentially was trying to return to an older form. So liberalism in this case is, you think of Adam Smith, the market economy, which at the time when it was coined was very progressive because you had kings and czars and emperors. And so the idea of an individual in a market was actually a progressive idea at the time. But what neoliberalism is a hearkening back of that. And in practice, we're returning in a way to levels of inequality and power relations and a change in the distribution of resources that's more akin to, the Gilded Age and to the monarchical and absolutism of the time period of the 17th, 18th, and then early 19th century. But that's a much longer conversation about neoliberalism and disability. But the point I want to make here is about the word reform. And reform, we think it's positive. Yeah, reform is a good thing. We're moving towards, the arc of history bends towards justice. However, in its efforts to increase freedom, increase dignity, and increase inclusion and combat justice and inequity. However, reform is just a word. It's a neutral signifier, and it can be repurposed to signal regressive as well as progressive change. And in this way, neoliberal reform is going backwards. It works to dismantle the protective and redistributive elements of the welfare state. And in practice, since the 1980s, this has devastating impacts for persons with disabilities in Canada, as cuts to healthcare, education, social support, all kinds of services, both kind of the ones that we see and the ones that are a bit more hidden, have disproportionately impacted this population. And as well, crucially, one of the aspects of neoliberalism that we talk a lot about in the health space is kind of privatization. But part of this as well is downloading the blame and the onus for health onto the individual, despite the fact that we know, and scholarship has demonstrated for years, that health is largely socially produced. This is important here because a similar thing is happening and is discussed in the scholarship around disability. That oftentimes neoliberal reforms have framed disability as a matter of individual responsibility rather than socially produced. And the great scholar A.J. Withers, who's out of, I believe, the Simon Fraser University in their 2012 book, which they've actually just reissued a new edition, which I have to get, writes that, quote, under capitalism, individual productivity is linked to individual worth. The more you produce, the more money you make, the more value you are to society. As productivity and worth are measured entirely in monetary terms, people who are left out of the system, such as disabled people, are worth less. End quote. So this is getting on to more particular policy and particularly around income support. So nowhere in Canada, regardless of province or program, do public income support programs, such as ODSP in Ontario, I believe the AICH, I believe in Alberta, or CBPD, Canada Pension Plan Disability Benefits. Nowhere in this country do they meet the basic needs of persons with disability. And indeed, in some jurisdictions, the amount supports offered are 50% below the normative, accepted poverty line. But these figures don't account for relative poverty of persons with disabilities, which I'll get to in a moment. And one of the consequences of neoliberal reforms has been the advent of workfare, which is nominally intended to get working age people, defined by Statistics Canada as 18 to 65, off of income supports and into the workforce, on paper to increase independence and economic security. But in practice, what these reforms have done is overall kick people off of benefits and oftentimes are forced into the labor market without the support, the resources, aids, transportation, and all the accessibility requirements that they would actually need, both to find and then crucially maintain secure employment. And in this context, we have the demonization of persons with disabilities. And at the core, the targeting and demonization of this population is a very worrying trend discussed repeatedly in the literature. In order to build essentially political room to target persons with disabilities, reformers must make them seem like a threat to the public. And there have been outright campaigns in several nations to portray these populations as dependent, needy, and expensive to the public purse. This has been particularly acute in the UK, and there are several good books and good sources, particularly Frances Ryan's book, that discuss this, the outright demonization. And indeed, the idea of the morally untrustworthy welfare recipient is ubiquitous in liberal welfare states, and it's tied to emotions of disgust, of shame, and of resentment. And essentially, this works by harnessing the negative emotions, disgust, shame, and resentments, against those who are positioned as deviant to the neoliberal order. And this has deeply, deeply impacted persons with disabilities, as many have internalized the neoliberal rhetoric of self-reliance and responsibilization. And because of this, they perceive themselves to blame for their poverty and their suffering. And as such, these reforms and then the rhetoric has made it easier to download blame for poverty onto persons with disabilities, often ignoring the worsening upstream influences of poverty or worsening upstream influences on the poverty and marginalization of this population. So this won't be a completely comprehensive review of present policy infrastructure, but I will focus on a few that I think demonstrate kind of what I'm discussing here. Oh, this is the last slide. So the disability tax credit. So this is the disability tax credit through which persons with disability can claim disability-related expenses. But, and this is crucial, the program is non-refundable. Now, what does this mean in practice? This means that you don't actually get reimbursed. All it does is reduce the amount that you owe. So it doesn't directly compensate for money spent. That would be a refundable credit. And to qualify, applicants must have and then also pay for, in many jurisdictions, a medical practitioner to certify. And oftentimes this is out of pocket. So to give you a demonstration, so if you're on CBPD and you're making the average amount, your income is so low that you don't really gain any benefit from the disability tax credit. So say you make $12,000 a year, right, on CBPD. What the disability tax credit does is it doesn't actually, and you claim, say, $2,000 worth of expenses. CRA doesn't write you a check for $2,000, right? You file your taxes, you itemize all your receipts. I paid for this mobility aid or this service or et cetera, et cetera. CRA will say, hey, okay, that's great. You're right. These things count. So next year, if you win the lottery, you'll have $2,000 worth of credits to your income. But because you're making $12,000 a year, you're above what CRA calls the base personal amount. So essentially, structurally, you will gain no benefit from the disability tax credit because, again, it's non-refundable. If it was refundable, CRA would write you a check for $2K. It's non-refundable. So what that means is because your income is so low and you don't pay income tax, you gain no benefit from the program. And this is, I would argue, by design, because at this point, CRA knows of this serious issue. They've been informed by many, many scholars and advocates in the area. But another aspect that's very, very important is the federal government's definition of disability is laid out in the Income Tax Act, and it is an extraordinarily restrictive and I would argue retrograde definition. It excludes many from who have prolonged and episodic impairments. It outright, I would argue, discriminates against those, particularly with the psychiatric issues of disabilities, by the barrier for anything kind of classified as mental in the statute and the law. The barrier to access the DTC is much, much higher in practice than it is for physical disability. So it is a very it is, I think, a bad program, but that's a much longer conversation. And part of the things that came up in my own analysis is there's a paradox at work, right? So the disability tax credit is not intended as a poverty relief measure, but as a tax equity program. Quote, designing the support as a tax credit, meaning that only those Canadians with disability who earn enough income to have them owing taxes can take advantage of it. Yet, it is an unfortunate reality that people with disability are often at low incomes precisely because their disability leaves them unable to work in full-time, well-paid jobs. Thus, the very people who need this support the most are the ones least able to take advantage of it. And this is the paradox. This only really provides benefits to the Canadians with disabilities with tax payable, owing taxes, but many Canadians with disability cannot generate tax payable because of their disability, because of lack of accessibility, and in some cases, outright discrimination. And yeah, they're literal unable to. And so into this comes the Registered Disability Savings Plan. So this is a program which you actually need to successfully obtain a disability tax credit to qualify for. It's a sibling program essentially to the Registered Education Savings Plan. Money deposited is matched up to a certain amount by the federal government. So there's some grants available, so you're able to get that every year, and then there's some matching amounts as well. The primary benefit, though, is for those who have the extra income to save. And unfortunately, as the research around the poverty levels demonstrates, that will leave out many persons with disabilities who don't have an extra $100, $200 at the end of every month to lock into this account, because there's also a 10-year kind of lock-in period where you can't access any of the funds. So it's not functionally a savings plan, it's a retirement plan, but that's another conversation. And indeed, the RDSP, going back to the research, doing my own research and going back to kind of the documents that were reported on when it was first being conceived of, it was developed as a proposal, essentially to better enable middle class parents to set aside funds to financially support a child with a severe disability when they're no longer able to provide support. So this is a program, I'll never say if you derive benefit from it, great. I'm not gonna, contest that. But the gains of this program are primarily designed for those who have gains to spare. The same with the disability tax credit. And so this is coming into poverty and the high rates of poverty. So 23% of persons with disability in Canada live in poverty, compared to 9% of the general population. And the risk of poverty increases with more impactful impairments. However, I think a very related, relevant, and underappreciated aspect of disability income policy and broader disability policy in general in Canada is the structural disability wealth/income gap, and the relative poverty rates because of the extra costs experienced by persons with disabilities in Canada. And that this is a worse relative poverty level. So research demonstrates that persons with disabilities experience higher day-to-day expenses, right? It can be, an extra aid, maybe extra medication. You can take, maybe an Uber instead of public transit. If you're having a bad day, you run out of spoons. But this, according to the research, ranges from about 12 to 40% additional expenses due to disability-related direct costs. And this is an important distinction. So these are defined as, quote, additional out-of-pocket costs required, for health services, medication, help with daily activities, disability-specific aid, etc. However, this is in addition to indirect costs, quote, which include foregone economic activities, work associated with the individual with disability and their primary carers in the household. So this is a statistic that holds as well in households where a general household where there is a person with a disability will have a lower disability wealth penalty. There's a lower wealth rate because of foregone economic activity. So if there's a person with a disability in the household, that household will suffer a penalty. And there's excellent research on this, and I can forward it to anyone who is curious. What I have found is that this extra cost penalty is not actually factored in when discussing the real poverty level among persons with disability in Canada. I find this is a huge gap. So all the statistics that I showed you, 23% to 9%, throw that 20% out. It's probably closer to 30, potentially even higher, because the figures don't account for relative poverty or real poverty, whichever your terminology is. And this is in addition that most persons with disability experience at least in two intersection social locations. To just provide two examples, women with disabilities experience significant barriers in education and employment, and of course the subsequent financial insecurity, as well as extraordinarily high rates of physical and sexual violence. Extraordinarily high. And as well for persons of color with disabilities, there's issues of poverty, of isolation, worse access to education and employment. They experience both structural racism and structural ableism. And so, getting in back to our old friend/nemesis, neoliberalism, a primary focus of neoliberal reforms have been to reduce poverty and dependence on social support through increased employment. This is in addition to the workfare programs. So while the overall employment rate for persons with disabilities in Canada was 65% compared to 80% for the general population, this drops according to severity of impairment to 50% for severe and 27% for very severe. Persons with disabilities are more likely to work in precarious jobs. And what these are in practice is so low wage, but not just low wage positions, but there's a lack of benefits and a lack of legal protections. And that particular aspect is crucial. If you're fired because you have a disability, oftentimes you don't have a union to fight for you, right? And you're not able to afford a lawyer out of pocket. And so the precarious job kind of begets itself. The precarity begets more precarity. And a primary barrier to securing and maintaining employment is outright discrimination and stigma, both in the workplace and by employers. Now, crucially, this reflects capitalism at work. As a 2010 OECD report argued that the current Canadian labor market actually incentivizes employers to remove persons with disability, which is not the case for any other charter-protected group in this country. And capitalist labor markets systematically devalue persons with disabilities, placing them in precarious work, and that employer attitudes and outright discrimination are not being adequately addressed as a reason for poor employment outcomes. And so a consistent theme in the literature is the lack of impact of government policy on poverty, and questions over whom exactly these policies are designed to serve. So Michael J. Prince attributes high levels of both unemployment and underemployment of persons with disability and their concentration in low wage, low protection, precarious work to policy choices made by the federal government around employment insurance and decreased disability program spending. And indeed, that same OECD report, which I mentioned earlier, criticized the fragmented nature of Canada's disability policy system, noting concern that many persons with disabilities who may be able to work more, meaningful jobs with some level of program support instead fall into unemployment or underemployment. And this is from a different OECD report, but this is the total percentage of GDP spent on incapacity, which for the OECD definition includes both disability-related spending and also potentially long-term illness. And you can see where we are. So the OECD average is about 2%. The highest is, Denmark. Again, the fact that the Scandinavian countries are at the top is not a surprise. They're basically at the top of any of these metrics that measure, health and well-being and prosperity, and is this country a good place to live for everybody? But Denmark spends, about over 4.5%, and we are there right close to the bottom. These numbers have gotten worse since the 1990s. You can actually chart them very clearly. But this is to demonstrate that we spend, I believe the number is 15% of what Denmark does on a per capita basis. To me, these numbers indicate the real priorities. There's rhetoric and there's policy documents and there's photo ops, and then there's the numbers. And the numbers tell a story. And so into this, I'm discussing the idea of part of my own research, which probably become the core of my dissertation, the ideal disabled neoliberal subject. And I'm pulling from several different threads of scholarship and several brilliant scholars to discuss this. So disability income support programs are, on paper, efforts by the state to mitigate against the negative consequences of lost earnings and additional costs due to disability. And these are, in theory, a right of citizenship. We think of the welfare state. In Canada, we have a public healthcare system, right? And that is a right of citizenship. It's part of the agreement that we've all made together that we think support should be provided to people in these cases to, if nothing else, ensure a minimum level of survival. However, in the neoliberal context, citizenship is increasingly oriented around the market, and rights become contingent on productivity in the labor force. Since I had originally written this paper, I've read Thomas Piketty's, who's the French political economist, book, Brief History of Equality. And one of the points, it's a superb book, a bit dense, but superb. But one of the points that Piketty makes is we are moving away from a society, with a market economy to a market society. And what that means is, instead of us and government being there, to prevent another 1929, to prevent another great crash, prevent another 2008. Instead, government has no longer moved from even just being an umpire between, the people and the market, to now instead just, the government's role is to increase monetary productivity. And if that comes at the expense of the people, then so be it. And that's longer, I think the data point for that most recently was the federal government's invoking of Section 107 in the labor strike, so overtly on the side of the market player. That's another longer conversation. I can give you a long list of excellent sources around political economy that kind of discuss the broader changes to the welfare state and to nations and the very nature of citizenship. In neoliberal context, increasingly oriented around the market. So rights instead become contingent on productivity in the labor force, right? So again, when you have a society that has a market versus a market society, the rights that you are entitled to derive from your participation in that market, not from citizenship. So the DTC and RDSP, these programs are nominally intended to mitigate against the systemic disadvantage of extra disability costs, the disability wealth penalty, and potentially, as someone, not being able to work full-time or work part-time or not at all. However, the disability tax credit does not benefit those with no taxable income. So it doesn't matter the amount of claimed expenses. If you claim $200 or you claim $2,000, you claim $5,000, the program requires you to have a taxable level of income. What's the number one way people generate taxable levels of income? By working full-time and well-paid jobs, right? Similarly, the full gains of the RDSP cannot be activated without the excess income to save. And so my argument is that this is the systemic inequity of the core of these two programs, that this is reflective of the neoliberal orientation in Canadian society. And these policies reward those who participate in the market, who work full-time and generate that taxable level of income, while we are cutting direct income support programs who those who don't work or are literally unable to. Again, citizenship in a market society is derived from your participation in that market. If you don't participate in that market, then you don't have rights and you don't have worth. And yeah, this is cutting direct and support programs. So this is the concept which I have somewhat landed on, the ideal disabled neoliberal subject. This is in a way the person for whom these policies are designed. So it pulls from very different kind of scholarly works. In a 2019 book chapter by the scholar Mo Stewart, it outlined the concept of the ideal neoliberal subject. And so this is one that's employed full-time and in compliance with the neoliberal market order, right? Is a good consumer and never questions any of this. And A.J. Withers, in that 2012 book, notes that the ideal disabled person in the West is, quote, white, straight, productive, profitable, and patriarchal, end quote. And then S.F. Schramm in a 2018 chapter discusses the increased surveillance and regulation of persons with disabilities on income support program, noting that those that are not, quote, financially savvy neoliberal citizen subjects, end quote, run increasingly afoul of harsh government disciplinary regimes, which seek to police and penalize persons who do not conform to this ideal. And a striking example of this is provided by the Plan Institute. It's an NGO that offers support for persons with disability in accessing the RDSP. So Plan did an interview with Rosie. So this is a real person, and this is not, I'm not negatively critiquing this person. I'm just using this as a case study to critique these programs. Mentions this individual who is a person with disability who works full-time. There's no mention in this article about any accessible or transportation or technology needs or accommodations made by their employer or by government. But this is a person who works full-time, is able to work full-time, and responsibly invests, her employment income to maximize the value of her RDSP every year. But a critical reading of this interview is very revealing, because you can see that Rosie is taking on to herself the onus to secure her long-term financial security in case of worsening impairment symptoms cause her to lose her employment. In essence, she will take the blame for resulting poverty if this happens, for not preparing enough, as the unspoken assumption is that her CPPD, which she would be entitled to, Canada Pension Plan Disability Benefits, is on paper designed for the situation where someone is working and being a good citizen subject and contributing, blah, 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 and then is unable to work anymore because of impairment issues and then receives this pension. But the idea is that this income from that would be so low that it wouldn't be enough to live on. So I want to be very clear here in the kind of unspoken assumption here is that this is an individual who is kind of working full time. If the impairment issues become, subsequent enough that either she can't continue to work or is fired, again, illegally, technically, because it's discrimination based on charter status. This is in case of that. So the RDSP is designed there. So yeah, the idea is taking the blame for the resulting poverty, not the system, not the lack of accommodation, not the outright discrimination, potentially being fired, but this is an internalization of that it's I am to blame for my poverty, I am to blame for my disability. And in a way, this individual, again, I'm not directly critiquing them, I'm using them as a certainly a case study, is the ideal disabled neoliberal subject. Someone who is never complaining, happily working, taking advantage of what limited programs are offered, never needing too much accommodation, never receiving requiring too much need on behalf of either industry or government, and then crucially, both receiving and accepting blame for the consequences of impairment instead of society providing income support to ensure a decent standard of living as a right of citizenship. And so Michael J. Prince argues that at their core, disability issues and particularly inequities are about power relations. For as persons with disability experience a lack of material, political, and cultural power, economic inequality follows. So in practice, persons with disability are frequently sidelined, overlooked, and made invisible in the policy process. And this is because in a realpolitik view, persons with disabilities in this country are viewed as lesser citizens. They're safe to be ignored, reflecting the power operations of state, civil society, and market institutions. So as Deborah Steinstra of the University of Guelph outlines, disabled people are implicitly and sometimes explicitly told that they're not worthy, that they're not enough value to receive human rights and related protections because they are or cause too much trouble or require too many resources. And finally, we are told through these stories that it's better to be dead or not to be born than to live with disability. And in this way, the exclusion and marginalization of people with disabilities shift from benign indifference or invisibility to neglect, acts of abuse, and murder. Thank you for joining me today. So I look forward to a panel discussion.